Hello, and thank you all for joining us for our webinar about the AbleTech Sooner Care iPad vending program. Do you have students who could benefit from using an iPad as a speech generating device? And did you know that AbleTech is a Sooner Care vendor of iPads for speech for kids? We are. I'm Kimberly Berry, AbleTech AT teacher, and joining us in just a few moments will be Sandra Wright-Hackler, who is program manager here at AbleTech. And Sandra will explain all about the process for applying for funding of iPads through Sooner Care, and in some cases, private insurance. As a result of your participation in this webinar, you will understand the items required for an iPad submission for funding by insurance, be able to state good components of video evidence for iPad acquisition, and gain resources available for review for iPad requisition. So let's welcome our presenter, Sandra Wright-Hackler, who is a speech-language pathologist and program manager at AbleTech. Welcome, Sandra.
Hi, thanks for having me.
We are so glad to have you. So I wanted to know if you would start off by just giving us a little bit about your background, and then we'll go into your training.
Sure. So I'm a speech language pathologist. Like you said, I have worked in private practice for the last 8 years prior to coming to AbleTech and being on staff here, and did all of the billing and things for that. So very familiar with the back end of this. How do you submit that funding packet, and how do you try to get something that's approved on the first go round? So happy to share that with others because it's quite frustrating.
Yes, I can imagine. All right, so let's get started with your PowerPoint.
Okay, so please jump in with your questions as they come along. A lot of this stuff is available through the Oklahoma AbleTech website, and I pulled it from our vending right here. So you go to okabletech.org, and then under the community service tab, you'll see the one that says Sooner Care Provider for Speech Generating Devices. And so I just want to walk you through kind of what the language on this website means, because we can't really give scripted information. However, we're going to try to give the best details we can so that it's not a repetitive process that you have to go through, because that can get very frustrating for families and therapists and all involved. So let's jump into what those requirements are, and then I'm going to go into them in great detail. And again, if a question arises, please jump right in with that. So if you scroll down on that, you'll see there are 7 requirements, although I'm going to tell you the word requirement itself is vague, because while some of them are listed, they truly aren't relevant anymore because everything has gone to an electronic nature. So I'll walk you through what those look like. And they've also recently redefined what recent means according to the Oklahoma Healthcare Authority. So I want to go through these requirements in great detail for you. So your AAC evaluation report, it is the meat of what has to get done. So let me give you a few tips on this. And this is both from an experience as a speech language pathologist who submitted these, and now as the person that reviews them before we send them to OHCA. Don't get over wordy. What you need to give is you need to give the main gist of what the purpose of the speech generating device is for. If it is to meet daily, if it's to meet daily living needs. Do you have a question? Okay, I'm going to keep going. If it's to meet daily living needs, request food, if it's to ask to go to sleep, if it's to say help me instead of pinching or screaming or crying, that's what you want to list in your AAC report. There are some general categories that Medicare requires, and we usually pull those similar for Medicaid. However, Sooner Care doesn't want as much detail on those. They don't really care about it, so don't waste your time on it, I guess is the gist of it. They want to know what's the medical impact, what's the impact on physical characteristics in terms of access. If they can access with their fingers, you can say that they're able to utilize their fingers to access device. Even if they're in a wheelchair, you can say that they're in a wheelchair, so they need something mounted. Unless you're using lower extremities as an access approach, they basically just want to know, can the child walk independently or not? Meaning, what kind of stability are they going to need to be able to carry around that AAC system, if that makes sense. So you want to keep it as practical as possible. I always say that reviewers for our lovely speech generating devices, we do have a couple of speech language pathologists, but it goes through medical reviewers prior to getting to that speech language pathologist. And so if there's a lot of verbiage in there trying to make it sound extremely technical, sometimes the medical reviewers will start to nitpick that. And so you don't want to give all that. The other thing with the AAC evaluation report is you want to make sure that you really rationalize how long your trial was and why it was that length of time. So I understand you can always borrow from AbleTech, but that's a short period of time, and that's a sufficient amount of time as far as OHCA goes and Sooner Care goes, as long as you note upon first trial, the child was doing communication through this modality. And during the first week of trial, this is what happened. And the second week of trial, this is what happened. And by the end of the trial period, this is what the child was able to demonstrate. The other thing is you want to match what the child's capabilities are with what you can give video evidence of. And so you don't want to give all kinds of details about things that we all know the child does, but as soon as you turn on that camera, the child forgets how to do everything. Even if they don't know the camera's there, it's an innate sense that this camera is capturing everything. So you don't want to list all these things that are possible and then have a video that shows minimal, because that will reject it almost instantly. And if it doesn't reject it, they're going to ask you for further video evidence, which I'll get to that later. So in your AAC eval report, you want to cover motor abilities for access, cognitive abilities, just that they're able to learn, and your trial length of what was it like before and what was it like after. And it doesn't have to be that the child can generate sentences and sequences and all of that. It can be they were able to make a request, which then allowed them to not hit, throw, pinch, whatever that maladaptive behavior might be. Okay, so that's kind of the tips and techniques on your AAC eval report. The second requirement listed is a certificate of medical necessity or letter of medical necessity. You'll see that LMN. Okay, let me tell you my cheat around for this, and it's not a cheat around, it's for real. But if you can put on a prescription, if you write the prescription for the physician to sign, and after you list the equipment that's being requested, you put a little line that says all the above equipment is deemed to be medically necessary, and the physician signs that prescription, it counts as both. It counts as your certificate of medical necessity as well as your prescription. If you don't have that on a prescription, or the doctor sends it to you on their little green pad or electronically, then you as an SLP, because we're able to diagnose it, are able to write a letter of medical necessity yourself. They like it to come from a physician, but it is not a mandate. It has to be from a person that's able to diagnose the communication condition and be able to state that it needs to be corrected or rehabilitated in some way, shape, or form. And so it does not necessarily have to be a letter that you write and then send to your physician to sign, although I've had some physicians do that. They're really great. So I will take and write the letter, sign it myself, put the physician name underneath, fax it to them, and have them fax it back to me. But it's kind of an extra step if it's a kiddo that I think is, I'm going to call him a borderline kid, and we can talk about what that means later on.
Hey Sandra, I
Yes.
wanted to type in, you had the verbiage. What did you say that you could write on the prescription?
So you can write a statement that says the above requested equipment is deemed to be medically necessary. Because you put it below on a prescription, you always have the name of the patient, and then you have what you're requesting, and then you put a little sentence that says the above equipment is deemed to be medically necessary.
Okay, I am just wanting to put this in here.
Yep.
You can all see my bad typing. It's taking me a minute. Okay, great. Thanks. I'll let you go on.
No problem. Insurance cards. I get a lot of questions about insurance cards. We don't need a Sooner Care card. This says that you have to send a Sooner Care card in. You don't.
I got that email, but I have no idea how to get it.
Hi. You don't have to send in a Sooner Care card. We have to have just the patient's name and the date of birth, and we are able to check eligibility through Sooner Care that way. We do check it when we are getting ready to ship a device to make sure that the student is eligible, the child is eligible, because if they're not eligible, we're not able to do that. However, if they are eligible, then nothing else has to be completed or submitted at that time. The exception to this rule, which is kind of a new venture for us that we are stair-stepping our way into, are private insurances, or your kiddos that have Sooner Care secondary to a private insurance. We do need a copy of those cards because the insurance companies require that we send the card along with all the necessary paperwork for them to do, which is ironic because they can do what we can do and look up by name and date of birth, but everybody likes to have their hoops that we jump through. So if you do have a private insurance in addition to Sooner Care or just a sole private insurance, then that is a card that we do need a copy of the front and the back of that. But for Sooner Care kiddos, we do not need a copy of those. And I know OHCA actually has stopped sending physical cards out to families. So don't worry about trying to hunt that down. We don't need it. Okay, your physician prescription. Oh, this is so fun because it has to be written with specifics. It has to be written in terms of what communication application, what case that you want, what accessories you might need. I mean, shoulder strap, padded case, carrying bag, all of that has to be included in the physician prescription or it doesn't count, even if it's in the SLP AAC eval report as recommended. Has to be signed off by the physician. Do not have to list a specific iPad version unless you are truly requesting a specific iPad. For example, they have the iPad Pro 12-inch, and if you need that 12-inch, you must specify the iPad Pro 12-inch. Otherwise, you get the newest version out from whenever your request is processed. So if a new iPad came out January 1 and your kiddo had not received their iPad yet, then they will get the newest iPad. You don't have to update that or send in, wait, you know, we didn't mean that version, we meant the newest, which is different than a lot of speech generating device companies because they will submit for whatever it is that you had stated. In terms of an iPad, you can list just an iPad. The other exception to an iPad is the standard is 32 gigabyte. I realize they make a 64 and a 128. If for some reason you need that, you can state it. However, OHCA will not fund that upgrade. And so because it's not medically necessary to maintain one communication application is their justification. And so just so you know, it will only fund the 32 gigabyte. So you can just put iPad. Like I said, if you need a different size, then you need to state that. I write my physician prescriptions. I write their name, I write their insurance and their address and their date of birth, and then I list in a row what they need. And so I will list iPad, period, and then I will list communication application of, and I will state that application, and then I will list whatever specific case. We're getting many requests for the chat wrap 10 case. No, if you just put chat wrap 10, that is all you get. You do not get a key guard, you do not get a carrying case, you do not get a strap unless those items in addition to the chat wrap case are stated. So you have to be as specific as possible. If you list durable case for an iPad, that puts it up to our discretion for what you get. If you want an OtterBox, you got to state it's an OtterBox. If you want one of those kid foam cases with a carrying handle, you have to list that specifically. You get exactly what you list as specific as you list it. So I hope that that makes sense with that physician prescription. The other snafu for that is it's a 90-day. It's 90 days from the day that we are able to submit it to OHCA for approval, not 90 days from the day that you mail it to us. OHCA looks at that packet when it gets to them, and then they look at that 90-day count back from when they receive it, even though we may have received it 3 days prior because we are able to fax all this information to OHCA and submit it electronically. So we are pretty quick at our turnaround within a day or two of when it's received. However, that 90-day window, they're pretty strict about, but it's pretty nice to have a 3-month window to be able to get that in. So the last thing that I usually ask for is that physician prescription as I'm putting my packet together. Does anybody have any questions about these before I go on?
I am not seeing any questions in the chat, but I wanted to ask just So basically you said they wouldn't get the upgrade for the iPad, but if they list, the type of durable equipment, are there any types of cases that, get denied, or really whatever case you put gets it?
And it's usually any case. Right now, they have not put a stipulation on a case type, but you do only get one for that 5-year period for OHCA covered by Sooner Care itself, but they have been very lenient in what they allow in terms of a case.
Mm-hmm. And then are you going to go into more detail about which apps are approved later? Okay,
I am. Yes.
We'll save that for later.
Yep. Okay, well then I will carry on. Okay, so prior authorization. This is what we do on our end, and we don't have a whole lot of control over it, just so you guys know, but I can give you the latest timeline. It used to be a little quicker, but as they've gotten more requests, then it's slowed down a little bit. So we complete all of this. Another thing that's listed on your requirements is an HCA 12A form. You do not have to submit that either, so you can mark that off the list. It's another piece of paper you don't have to get. If you're not familiar what it was, I had printed one out, but it's a little grid sheet, and then it has like the physician information, the member information, and then the requested items. You don't have to do any of that. They've gone to an all electronic method, and so we no longer have to have a physician prescription on that or signature on that, because they're now taking the prescription as being valid. They do have to match. That's where that matching comes in. So what we request on the prior auth has to match what's on the prescription. And so that's why verifying that your prescription is indeed what you're looking for is really critical, because we cannot change any of that here in-house. So don't have to do any of that. It is you guys' responsibility, though, when you submit, and they have a private insurance, to get any prior authorization that's needed for that private insurance. It's pretty simple. All you typically do is you fill out a cover fact sheet, you fax the copy of the forms that you are sending to us to the insurance, and then they will send you either an approval, a pre-certification letter, or a denial, it's not covered letter, and you submit that with us as well. And then we're able to follow through with that. If you guys have any questions about report writing for some of those private insurances, because it does look a hair different in terms of what they require versus what OHCA requires. I have a lot of people, I think on our website, we still list you need to have 3 trials of devices. They don't care. Sooner Care doesn't care if you have 3 different trials now. They want basically what were the features of the particular item that you tried and why did that work. And then you might list what some other comparable are and some of the features that then don't match with what your child's needs are. However, if you're talking private insurance, that changes a little bit. So I'm happy to talk about some of the private insurance nuggets that you might have interest in as well. So prior auth, you don't have anything to do as long as you send us all the paperwork. If you do send us something that looks questionable or it has wording in it that I think isn't going to fly, I'll shoot off an email to you guys or a call and just say, we got this funding packet. There's a sentence in here that says, the child talks to its parents. I'm going to say, well, this is going to auto deny you. Is that what you meant? And if you say, yeah, that's what I meant, I'm going to say, we can submit it, but the likelihood of acquisition is low. Or you can say, no, well, I mean, like they talk in home language. I'll say, okay, you need to put that on there that it's not understood by others and wouldn't be functional in the community. And then so that way you guys are given the opportunity to kind of tweak what you need before we go through that submission process for prior auth. Everybody's favorite question. I probably get at least 3 phone calls a day about video. What has to be in my video? What should my video look like? How long should it be? If you go to the OHCA website, it says no more than 15 minutes. This really means they want a shorter video that can capture what it is that you're trying to demonstrate. So this goes back to your AAC evaluation report in terms of only include what's pertinent. If the child is able to, I hold up this item and this item and I say, okay, what is this? And they say it's a rabbit and they're right, that's all you have to have a video of. If you're gonna use yes, no, I hope y'all are sitting down. They want you to say, is the sky blue? Yes or no? And the child says yes. And you say, did you mean yes? And then the child has to say yes again, because otherwise they say that's a 50-50 chance of a yes-no question. They are looking for kind of a receptive language task, which is utterly ridiculous. We don't make the rules, but they make the rules. If they want to see who just walked into the room, Sandra, oh, is that Sandra? And they smile, or they give some indication like that's what they were looking for. Private insurance don't really care about videos. They want it all written in the report. So they don't need any videos to have as evidentiary support for your request. So what I suggest is you take a couple of videos. You try to send no more than 5 minutes, because the longer you send, the more there is to kind of sparse apart. The other thing is you don't want to have a lot of chunking of videos, so you don't want to take and look like you're clipping out a video to make it look like it is something. They'd rather watch that 3 minutes of silence that is very hard for all of us, but they'd rather see that and then see a correct response. And then in the report, you can note that that delay time is decreasing as they're figuring out where items are located within the program itself. So if you take your video and then you watch it and then you go write your support in your report, then you have a better time of kind of matching it rather than going through, because we like to be so proud of everything that we're seeing in terms of language growth, but then when we list that they can do all these things and it's not captured in that video snapshot, they throw it out. So it's a little disheartening to have all of that. The last thing that's on here is your physician notes. Okay, so the good news is it can be any time within the last 12 months, again, of the date that we submit it for prior authorization. So they don't have to go get a new doctor visit for this. Unless, there's always a little disclaimer, there is no comment in the physician notes that the child is either nonverbal, poor communicator, demonstrating maladaptive behaviors, which most of the doctors are pretty good about including something like that in their everyday, like, well child check visit notes. But if you don't see anything in there that states nonverbal, delayed communication, aggressive behaviors, maladaptive behaviors, things along those lines, then you do want to put in an addendum request. They don't necessarily even have to do a visit, and most doctors will write a little blurb that says this child is primarily nonverbal and unable to communicate independently at appointments, or whatever that may look like for them. And then they'll just sign that and you attach that to their last visit note, and OHCA will accept that. They just need to see some documentation from the physician that yes, indeed, this child is nonverbal and needs this in terms of being able to be a communicator. And let me put a little caveat on nonverbal. So kiddos like with apraxia of speech, it doesn't have to be that they are entirely nonverbal. It has to be that their verbal communication is inconsistent and non-functional at times. And so they've gotten a little more loose about that, because it used to be that if a child had a yes, no in any manner, they wouldn't fund it. And now they really are looking at global communication in a variety of settings with a variety of people. And so we've had some wins in terms of that. Questions about those requirements? I'm going to go through some of the hidden nature of this process.
It occurs to me that a lot of people will be wanting to, increase the literacy of their students and their ability to, communicate in all settings and, do better in school. But for this application, you can't really focus on the educational aspects of it. Am I correct in that?
Correct. Even if you're in a public school setting, because the whole purpose of getting an iPad is to help with expressive communication. Now, that doesn't mean that they can't use the speech generating device, in this case an iPad with a communication app, to answer questions that they then have a dictator or somebody dictate for them. Translate, right. You guys know what I mean. Pick a word, speech pathologist brain, all these words come to mind. And so, yeah, they want just the in and out of the functional expressive language piece. That's all they want. So let's talk about some of these nuggets. And this is the one I'm going to debunk some of these, because some of these are no longer true. We're trying to do an update, but we're really working on a lot of in-network status with some private insurance companies, and so they do have some of these, and that's why it's still out there. So Sooner Care will only approve devices for persons up to age 21. That's even a week before their 21st birthday. I managed to pull that one off. It was very close, but it was the desperate call to the manufacturer of the speech generating device, like, I've got 3 weeks to get this done, and if it's not processed, it's not going to happen because they're going to age out of this coverage, and then it's not covered. So Medicaid, as many of you probably know, is not a covered, DME is not a covered entity under Medicaid after the age of, once they turn 22. The other thing is, so your evaluation must consider 3 different devices. Like I said, not entirely true. It depends on your insurance and your funding source. Also depends on what you've done. So if you have trialed different devices, then note that. It doesn't have to be in length. You don't have to have a page for each one. You just want to state this device was trialed. These are the different kinds of activities that it was used for. This was the interaction and engagement level. And then this is, what the outcome was and why it wasn't deemed as sufficient. And you can list those. Listing those is not going to be a ding or a negative mark against you. It's just going to be more information for the family and just kind of as part of that child's permanent record in terms of speech services. Your request must be by a licensed SLP in the state of Oklahoma for AbleTech to be able to process the vending of it. Okay, you can't have an SLPA do that. You also can't have, even though they're a licensed SLP, you can't have a rep from a company come write your letter and then you sign off on it. You can work collaboratively with others, and you can have collaboration from your OT, from your PT, from anybody that may be working on access issues with you. They can absolutely sign it, but the request has to come from the speech language pathologist because, again, we're talking about that expressive communication function, and that's really all they care about. So all those other, well, how are they going to get to it and how's it going to get from place to place? It's sad, but it's such a minor thing that are they going to be able to express themselves? Okay.
So let me just interrupt for a second. So we do have you and Allison on staff who are speech language pathologists, but
Correct.
Just to clarify, you're saying that we won't be the ones to be signing off on this. We need the client to have a speech language pathologist that is submitting this report.
That's correct. And I will tell you that Allison and I are both willing to send forms and templates of reports based on age, diagnosis, severity, things along those lines, because we've seen a lot of them. And so we do have a few templates that we'll email out, but no, we cannot, we can't do your evaluation because we are the vendor. So a lot of people say, will you come evaluate my child? We can't do that because we're a vendor of a speech generating device. And so that's a conflict of interest for us, but we are happy to help walk you through that process, give you any paperwork guidance and things you need. And we have some of that on our website as well of different resources to go through. And we are happy to walk you through and answer questions on step by step as you go through this process. We just can't help facilitate any of that just because it would be a conflict of interest for us. And so you had asked earlier about cases and things you'll see here. So you can get an iPad up to $499. Now, I told you about the gigabyte. That's kind of a hidden nugget in here. If you put a 64 gigabyte, they're going to throw that back and say why a communication app is only this large. And so they don't want to see, well, they're going to watch YouTube and they're going to FaceTime and they don't care about that. They're just looking at that expressive communication piece. Then it will give you a communication application, which I'm going to show what their list is, and then we can talk a little bit more about what that means. And then it says a durable case, but really right at this point it will support any case, but it's the case that you list on your report. If you should have a private insurance, that's kind of what this next piece of information is for. So this is billed under, if anybody's in a school, I'm sorry, because when I worked in the schools, I didn't even know these codes existed. As a private practice SLP, they're very important. So you have a CPT code or your HCPCS code, which is E2599. The only reason you need to know that is if you want to find out if it's a covered service from a private insurance, you tell them, is E2599 covered? And E2599 covers that bundling. It covers the iPad, the app, and the case together. It's not each one is separate. And so it's one unit, one bundle that goes through there. And so you can always contact an insurance company and see. They used to all deny them because iPads are too multifunctional and they can't be locked in, but Blue Cross Blue Shield is now paying for a few. TRICARE is now paying depending on which plans people have, and so we're starting to see more acceptance of this, and obviously they're probably figuring out it's a little more cost effective than some of the very durable dedicated system. On that same note, Sooner Care is the payer of last resort. And so if there is any indication that a child has another insurance company and Sooner Care knows, even the situation I've had happen a lot is the family had private insurance and the child had Sooner Care. Somebody in the family changed jobs, lost a job, so that private insurance went away. Well, they never notified Sooner Care. So Sooner Care still sends us a denial saying they have this primary insurance. So we then have to contact the family and say they're still showing this is here. They say, oh, that hasn't been there for a couple months. Well, then they have to contact Sooner Care and make all of that process happen before it is able to be billed. And that can take 4 to 6 weeks for that process to happen. And families do this in private practice quite a bit. They'll change insurances, and even though everybody has a sign that says, please let us know if any insurance change, they don't always. So that is one that we see often here, which is a little unusual to see, but I think they just think, oh, it doesn't matter because we don't have that. Well, then we have to go to that private to get the denial. They say that's not a member, and then it delays the whole process.
On that note, Sandra, when you've had a denial like that and you have to start the process over, or do you start from scratch? Do you have to get the prescription again? Does the time clock start again?
You're in the same timeline. So if your prescription's still within 90 days, your clinical notes are still within a year, you don't have to redo it. We can resubmit it as a request. So if you're in that 90-day period, and the great part about doctor's notes is you may need a new prescription, but you don't need new notes, you don't need a new AAC report. What they want is an addendum that basically says this is still the case for this child, even though this time period has passed due to processing of requested equipment. So you don't have to reinvent the wheel. You may have to get a few pieces depending on where you are in that timeline. That's a good question. I will have people that say, I started all over. I'm like, don't do that. So there you go. Okay, so how do you do this? Excuse me. On our website, like I said, we have PRC, not to promote any given organization or company. They have a pretty good funding assistant. I've had some SLPs call me though and say that it's challenging to get that printed. And so I haven't gone into great depth about that. I know Satillo, who's also a subset of PRC, they have put out something similar for a basic AAC eval report, and I think Toby Dynavox is working on one as well, if I'm not mistaken. You can use those as resources. Like I said, you could call Allison or myself, and we are happy to kind of let you know what your topic heading should be within the report, or send you an example of a template of a report that's more basic depending on the kiddo that you have. Once you put everything together, which sounds like a long list, so you have your AAC eval report, you have your letter of medical necessity and or prescription, not or, and prescription, but maybe they're one document, and you have video evidence, you have doctor's clinical notes from the last year. That is really all you need to submit. So it's 4 different items that we need, possibly 5 if your prescription and your letter of medical necessity are 2 separate documents. You can put those, videos, I wish they'd make up their mind. It used to be that you could upload it electronically and we could email it. They put that out for about 2 months every year. They let us do it, and then they say nope. But we can send it via a flash drive or via a DVD. If you make your recording on a DVD, because OHCA is OHCA, they won't play the DVD in a computer. They only play it on a portable DVD player. I'm not lying. And so make sure that that is playable in a DVD player and not just on a computer. Our computers are much more technically savvy, and they can understand a DVD minus R, a DVD plus R, a CD minus R, a CD plus R, and play it for whatever means it is. But if it doesn't play in a DVD player, then they will submit that back and they'll say this is an unreadable DVD. You then have a 14-day time period, and that's calendar days, not business days, from the date it is sent back to send them a new DVD. If this happens and you are the person that's responsible for getting that to them, make sure that you touch base with me at AbleTech, because I can give you the form, I can email you the form that has to go with it when it goes back, and you can mail it directly. I know some of the big issue is you have to take and mail it from Ada, Oklahoma to Stillwater to have it go back to Oklahoma City, where it could go from Ada to Oklahoma City in a day or two, but now it's got to go from Ada to Stillwater, which of course is coming on campus and go through campus mail and then get back to Oklahoma City, and you're talking about 4 days. And so we can save you some of that time, because you have to get the video, make the video in a format that can be read, and then get it to them. And so I am happy to help you walk through that. I haven't seen as many requests for additional DVDs lately as we used to get quite often. So,
hey, when we get denials, or they say something about the video, is AbleTech getting that notification, or
yep.
is the submitting SLP?
Nope, it's us. It comes to AbleTech. We then call or email you as soon as possible to let you know. So you've already lost 2 days from when they date the letter and put it in the mail for it to come to us. And then we have to contact the submitting SLP in order to be able to get that and then get that in. Yeah. There's always a middleman. Okay, so here's your list. Take it for what you want, because I will tell you that I have yet to also have a communication application get denied. And so they seem to be pretty broad in what they accept. The most common are Prolo, Quota Go, LAMP, Words for Life, and then Touch Chat, which you'll see is actually not on this list. Touch Chat's pretty new. And it's some combination between Prolo, Quo, and LAMP. It's in the middle, if you're not familiar. We've had very simplistic apps like Acorn get approved. And so we have yet, again, I don't think they're nitpicking the application itself apart. I think they're just looking at the overall package. And so this is what OHCA lists on their website as what they deem as approvable. However, they have not denied us an application yet. So I put this up for your reference just so you can see, and it is listed on our website because that comes from OHCA website, but like I said, we have yet to have anything get denied in terms of an application. So how is this delivered? So we compile your package. So we compile your iPad, your case, and all of that together in one container. You then get a piece of paper with a redemption code. And this is probably the most confusing for people, but the application itself belongs to the member whose insurance paid for it. It does not belong to AbleTech. It does not belong to the SLP. It belongs to the member. And so the reason that we do a redemption code is because that member's family should have their own iTunes account that goes with that particular iPad. And so they can go in and they can redeem that code, which then that communication application they requested becomes theirs on their iTunes account, and obviously can be uploaded or I guess it would be downloaded onto up to 5 devices at any one time. Okay, so we don't load that. I get a lot of people that call and say, it wasn't loaded on the iPad. They turn it on and it's not there. Nope, because there's a piece of paper that comes with the redemption code so that the application itself belongs to the member, does not belong to us, and does not belong to the SLP. Doesn't mean that the member can't say, hey, SLP, let me see your iPad. They put in their iTunes account, they download it, they take their iTunes account off, and you have access to it. Many families will do that, but it does belong to the member itself. The other thing that Sooner Care will not pay for, but we highly recommend, is Apple Care. So the iPads that we get, they are not covered by Apple Care. OHCA cannot ask for it, even though it may be a child, because what they'll say is if the child's likely to break it, then you need to get something that's more durable. So it's a catch-22 to ask for that. So it is not covered under insurance, but it does not mean the family can contact Apple, give them the serial number that's on the back of that iPad, and instantly they have, I think it's 60 days to be able to load and have Apple Care for that iPad. I think it's a 1-year or 2-year deal, depending on what you want to pay. The other thing is repairs are covered. They are covered under the same premise as the iPad itself. However, you need a little bit of additional paperwork. what else is new, right? So you have to have an SLP addendum, and that addendum just says their iPad was damaged due to daily use or due to being dropped, you know, whatever, however you want to explain that it was damaged. You go through an Apple Store, iTunes, you contact Apple. They'll give you a quote saying that yes, indeed, that's repairable or non-repairable, and either way it counts as a repair. You get a new doctor prescription saying repair of iPad, and again, letter of medical necessity I put on my prescription that just says yes, student still using this, child still using this, it's, you know, still meets their communication needs. Once you get all that in place, and you just, as an SLP, you write they're still using their iPad to communicate, they're doing this and that, you do not have to have a video. You don't really have to go in depth about the communication app. You just say, yes, they're using this in all environments to be able to express themselves. I mean, it has to be that simple. And then you sign your name. And then you send that to us, and then we can get that authorized as well. A repair or replacement from us means that you're getting a new iPad. They're getting a brand new iPad. We don't actually fix iPads. They go into refurbished and all of that, even through Apple. But a lot of people don't realize that the repairs are a covered service of Sooner Care, and so they do that. How's all that in a nutshell? Questions that you guys might have about any of that process? Kim, I think you're muted. I see your mouth moving, but can't hear you.
Okay.
There.
Now you hear me? Okay. I put in the last call for questions. So hopefully if there are any questions from our audience, they will ask them. And me, being a former news reporter, I'm always here ready with questions. So what if the trial was not long enough? What happens, you know, the AbleTech trial loan?
What they'll do, well, there's a couple. You've got two avenues. So one, if you feel as a professional that you don't have enough evidence, request a second trial. Two, if it's not long enough from OHC, if they see a glimpse of something hopeful but don't feel like it captured enough, they'll ask for additional video. If they feel like it was not a good video and they don't want to consider it, then they'll deny it. Mm-hmm. I've seen all of those happen.
Okay. Final question. What is our success rate for getting iPads for speech generating devices approved and funded through Sooner Care?
Good. We are currently, it used to be about 60 to 70, and we're now at about 90. 90% of those requests that you guys are sending in, we're able to get approved and sent out. And our turnaround time, because I always get that, if you have, if I got a packet today, it would be sent off for prior auth. The prior auth process from OHCA is currently 7 to 10 days, calendar days. So it's not bad. Usually if I send it in Wednesday today, I'll know by Friday of next week whether it's approved or not. And then we're able to usually ship within a week. So yeah, it's pretty quick, and we have a pretty high turnaround rate. So I think that that's great.
Awesome. Okay, well, thanks so much for joining us, Sandra, and providing us this useful information. And those of you joining us today, if you need to reach Sandra, her contact information is right here. You can call her at 405-744-5170 or email sandra.wright-hackler@okstate.edu. And finally, if you need documentation of your participation, just let me know. My contact information is there on the screen, kimberly.berry@okstate.edu, or call me at 405-744-8342. The 800 number for AbleTech is 800-257-1705. So you can call to get information from any of us at that number. So thanks again, everybody, and have a great day.